Today we are talking about quitting weed during pregnancy. And I'm going to be honest about how hard it can be, why it feels so hard, what your body goes through, what triggers relapse, why avoiding people and places matters, what we actually know about risks to the fetus, why contaminants like pesticides matter, why there are not enough safety studies, and why there can also be legal and social consequences, like DCFS or CPS involvement, depending on where you live. If you are quitting right now, or if you are trying and slipping, I am not here to shame you. I am here to make it clearer so you can make a plan that actually works. Let us start with the most important medical point. No major medical organization says cannabis is safe during pregnancy. There is no known safe amount. THC and other chemicals in cannabis can cross the placenta, which means they can reach the fetus. That is why public health agencies like the CDC advise against cannabis use during pregnancy. And yes, there are still gaps in research. There are not enough high-quality safety studies in pregnancy, partly because cannabis has been federally illegal and because you cannot ethically run randomized trials on pregnant people. But a lack of safety studies does not mean it is safe. It means we do not know the safe threshold, and when the stakes are fetal development, medicine defaults to caution. Now let us talk about why quitting is so difficult, because this is where people feel like they are failing, when really they are going through something very real. For a lot of people, weed is not just a recreational thing, it becomes a coping tool. It becomes how you sleep, how you eat, how you calm down, how you tolerate stress, how you numb intrusive thoughts, how you get through your day. So when you quit, you are not just quitting a substance, you are removing the thing your brain has learned equals relief. That is why cravings do not feel like a casual thought. They can feel like an emergency. They feel physical, they feel urgent, they feel like I cannot handle my body without this. And pregnancy can make that worse, because pregnancy already brings nausea, insomnia, hormonal shifts, mood swings, anxiety, body pain, and stress. So quitting can feel like you are stacking discomfort on top of discomfort. Now let us name something clearly. Cannabis withdrawal is real. It is recognized. It is not in your head. Withdrawal symptoms can start within 1 or 2 days after stopping. They often peak in the first week and can last a couple of weeks, sometimes longer, especially if you used heavily or daily. Withdrawal symptoms can include anxiety, irritability, anger, depressed mood, insomnia, restless sleep, vivid dreams, nightmares, reduced appetite, stomach pain, headaches, sweating, chills, and physical tension. So if you are quitting and you feel wired but exhausted, or you cannot sleep, or you wake up with a racing mind, or you feel angry at small things, or you cry for no clear reason, or your appetite disappears, or your stomach feels unsettled, that can be withdrawal. Now add pregnancy on top of that. Pregnancy can cause nausea and vomiting, food aversions, fatigue, constipation, reflux, headaches, mood swings, and body aches. So quitting weed during pregnancy can feel like my whole system is on fire. And this is where people often relapse because they think, I cannot do pregnancy like this. So I want to say something that matters. This intensity does not mean you are weak. It means your nervous system is recalibrating. It means your brain is adjusting to life without THC at the exact same time your hormones are shifting and your body is building a baby. Now, let us get very specific about what your body might feel, because vague advice does not help. Here are the most common, uncomfortable experiences when you quit. 1. Sleep problems. You might not be able to fall asleep, or you might fall asleep and then wake up at 3 a.m., or you might have vivid dreams, or nightmares, or sweating, or restlessness. You might feel tired all day, but the moment you lie down, your body feels wired. 2. Appetite changes. You might lose appetite even while pregnant. Food might taste wrong. Smells might turn your stomach. You might feel hungry and nauseous at the same time. If you used weed to help you eat, quitting can feel like, I cannot get food down. 3. Nausea. Some people used cannabis specifically for nausea. When you stop, nausea can feel louder. Also, I need to say this. Cannabis is linked to a condition called cannabinoid hyperemesis syndrome in some people, which causes severe nausea and vomiting, and it can get worse with continued use. So if you have ever had cycles of intense vomiting with cannabis use, that is important to talk about with a doctor. 4. Anxiety. Anxiety can spike. Panic can spike. Intrusive thoughts can spike. You might feel restless. You might feel unsafe in your own body. 5. Irritability and anger. You might feel snappy. You might feel like everything is annoying, and then you might feel guilt because you do not want to be that way while pregnant. 6. Physical tension. Tight jaw, tight shoulders, headaches, chills, stomach cramps, and a general sense of discomfort in your skin. Now, here's what many people do not realize. A lot of relapse is not about lack of willpower. It is about triggers. So let us talk about triggers the way they actually work. Triggers are not just people. Triggers are places, objects, times of day, sounds, smells, routines, emotions, even certain shows or songs. If you always used at night, night becomes a trigger. If you always used after eating, finishing a meal becomes a trigger. If you always used after conflict, conflict becomes a trigger. If you always used in your car becomes a trigger. If you always used in one room, that room becomes a trigger. Your brain learns this cue equals weed, and weed equals relief. So quitting is not only quitting the substance. Quitting is breaking the entire cue, craving, use loop. And during pregnancy, it is smart to reduce exposure to triggers. That is not weakness, that is strategy. This is what I mean by that. Remove everything. No stash, no edibles, no vape pens, no cartridges, no grinders, no papers, no lighters, no ashtrays, no jars, no smell-soaked hoodies. If you keep it, your brain stays in negotiation mode, like maybe later. Do not keep it. Next, change your environment. If you used on the couch, change the couch routine. Sit somewhere else. Put a different blanket there. Change the lighting. Change the scent. Put a water bottle there. Put a snack there. Make it a new space. If you used in the car, clean the car. Air it out. Use a neutral scent. Change the playlist. Change the route. If you used in the bathroom, change the bathroom routine. Different soap, different time, different sequence. It sounds small, but it matters because you are breaking associations. Now let us talk about avoiding people and why that is not judgment. If you are quitting weed during pregnancy, being around people who use is one of the highest risk situations because you will smell it, you will see it, you will watch them relax. Your brain will say, remember how that felt. Also, some people will pressure you, or they will minimize it, or they will say it is natural, it's fine, it helped me. You do not need to debate. You can set a simple boundary. You can say, I'm not using during pregnancy and I cannot be around weed or smoke right now. I care about you, but I need space from that environment. That is enough. Now let us talk about why it is worth quitting, in factual terms, not scare terms. First, THC can cross the placenta, meaning it can reach the fetus. That's a big deal. Second, studies have found associations between prenatal cannabis use and outcomes like lower birth weight, and some studies show increased risk of preterm birth and NICU admission. Not every study finds the same strength of association, and confounding factors exist, but the overall body of evidence is concerning enough that medical organizations advise against cannabis use during pregnancy. Third, there are concerns about neurodevelopment. Data are mixed, but again, it is enough concern that the recommendation is to avoid. Now, let us talk about the part many people do not think about. Contaminants. Cannabis is a plant, and plants can carry what they are grown with. Cannabis products can contain pesticide residues, heavy metals, mold, and residual solvents, especially depending on how it was grown, processed, and tested. Testing standards vary widely across states. Labeling is not always reliable. Potency is not always what it says, and black market products are even more unpredictable. So even if someone thinks it is just a plant, what matters is what else is on it, what was sprayed on it, what it absorbed from soil, what it picked up from processing, and what concentrates into oils and edibles. And in pregnancy, chemical exposures matter because fetal development is sensitive, especially in early stages when organs are forming. Here's the core reality. Even if you cannot quantify exact risk from pesticides on cannabis in pregnancy, you can understand the principle. If you add an avoidable chemical exposure during pregnancy, and you do not need it medically, and you do not have safety data, it is not a risk worth taking. Now we need to talk about the part nobody likes to talk about, but it is real. Social consequences and legal consequences. Depending on your state, your hospital, and your specific situation, Cannabis use during pregnancy can sometimes lead to involvement from child welfare agencies like DCFS or CPS. This is not the same everywhere, it varies widely. But hospitals sometimes do drug screening on pregnant patients or newborns, especially if there are medical concerns like preterm birth, low birth weight, signs of neonatal distress, or a history that triggers screening. If a newborn tests positive for THC, or if cannabis use is documented in medical records, there can be a report or a notification or a social work consult, depending on policy and state rules. Even in states where cannabis is legal for adults, that does not automatically protect pregnant people from scrutiny because child welfare systems focus on fetal and newborn safety, not adult legality. Possible outcomes, depending on circumstances, can include a hospital social worker visit, interviews, home visits, a plan of safe care, referrals to services, monitoring, and in some cases, escalation, especially if other risk factors are present. And even when nothing severe happens, the process can be stressful, invasive, and frightening, right at the time you need peace and recovery. So quitting weed during pregnancy is not only about physical health, it is also about reducing the risk of being pulled into a system you did not expect to deal with. Now let us shift to something practical, because you need a plan that matches real life. The biggest reason people relapse is untreated symptoms. If you used weed for nausea, you need nausea support. If you used weed for sleep, you need sleep support. If you used weed for anxiety, you need anxiety support. So talk to your OB, your midwife, or your prenatal provider and be honest. You can say, I stopped, I am struggling, and I need help managing nausea and sleep so I do not relapse. That is a reasonable medical request. There are evidence-based treatments for nausea in pregnancy. There are sleep hygiene strategies that are safer. There are therapy tools for anxiety. Sometimes there are medications with more established pregnancy safety profiles that can be discussed when symptoms are severe. And I want to say this clearly. If someone is using cannabis to manage severe anxiety, depression, or trauma symptoms, that is not a moral failure, that is a healthcare gap. That is a sign they need support, not judgment. Now here is a simple quitting framework you can use. First, remove access. Get it out of the house, get it out of the car. Delete dealer numbers, unfollow dispensary pages. Stop going to the places where you buy it. Second, remove cues. Change routines. Change the evening pattern. Change the room where you used. Change the route you drive. Change the show you watch. Third, protect your social environment. Take a break from friends who use. Avoid hangouts where weed is present. Ask your partner to keep it out of the house. Ask for respect. Fourth, replace coping. If cravings hit at night, build a night routine that starts before cravings peak. If cravings hit when you feel nauseous, have a nausea plan, small snacks, hydration, whatever your provider recommends. If cravings hit when you feel anxious, do something that changes your body state, like a short walk, paced breathing, cold water on your face, a shower, or calling someone. Fifth, plan for the craving wave. Cravings rise, peak, and fall like a wave. So when a craving hits, do this. Name it. This is a craving, not a command. Delay it. Give it 15 minutes. Do something physical. Drink water, eat something small, walk, shower, brush your teeth, change rooms, step outside. Do anything that shifts your nervous system. Most cravings do not last forever. They feel permanent, but they are not. Now let us address the mental traps that make quitting harder. Trap number 1, all or nothing thinking. I already used, so it is ruined. No. Every day you do not use is less exposure. Every reduction matters. The goal is forward motion. Trap number 2, shame. I am a bad mother. Shame makes people relapse. Shame makes people hide. Responsibility is not the same as self-hatred. You can say, I am changing this now, and I'm going to protect my baby. Trap number 3, isolation. People hide because they are afraid, but support makes quitting easier. Even one supportive person can lower relapse risk. If you need help, reach out to your prenatal provider, a counselor, or a support group. Now, I want to talk about something else that can happen in pregnancy. Some people say, I cannot quit because I feel sick, and weed helps. But sometimes weed can also worsen nausea over time, especially in people who develop cannabinoid hyperemesis syndrome, which can cause recurrent severe vomiting and dehydration. So if you have had patterns of intense vomiting with cannabis use, quitting is not only safer for the baby, it may also be safer for you. Now, if you are listening to this and you are in the first week of quitting, here is what I want you to expect. Expect irritability. Expect sleep disruption. Expect cravings. Expect your body to feel unsettled. Expect emotions to spike, and then expect improvement slowly. The goal is not to feel perfect. The goal is to get through the hardest part without going back. And if you are struggling right now, I want you to hear this. You do not have to do this alone. You can ask for medical support. You can ask for nausea help. You can ask for sleep help. You can ask for anxiety help. You can ask for counseling. You can ask for a plan. And you can also protect yourself socially. You can avoid people who trigger you. You can avoid places that trigger you. You can change the routine. You can set boundaries. Now let me end with a simple reminder. Quitting weed during pregnancy is hard because pregnancy is hard, and because withdrawal is real, and because the brain remembers relief. But it is worth it. It is worth it because THC can reach the fetus. It is worth it because there is no proven safe amount. It is worth it because contaminants like pesticides and heavy metals can exist in cannabis products. It is worth it because we do not have strong safety studies, and uncertainty is not reassurance. It is worth it because there can be legal and social consequences, including child welfare involvement, depending on your state and your hospital policies. And it is worth it because you deserve a pregnancy where you are supported, not trapped in a cycle. If you are quitting right now, I am proud of your effort, and I want you to keep going. If this helped you, please like and subscribe. And if you want, leave a comment with what you are struggling with most: nausea, sleep, anxiety, cravings, or triggers, and I can make another video that goes deeper into that specific piece.